Hi, my name is Jonathan Maruka. I'm the state medical officer, and today I'm going to be talking about the Ebola outbreak in the Democratic Republic of Congo. So the Ebola virus here, we're talking about a rare deadly zoonotic disease infecting or affecting humans, monkeys, gorillas, chimpanzees, and a reservoir host being our African fruit bat. The Ebola virus was first discovered in 1976 on the Ebola River, which is now considered the Democratic Republic of Congo. Since then, viruses have been infecting people from time to time and also spreading to other nearby African countries or regions, with the fruit bats being a host reservoir and most likely source of the infection and actually carrying the transmission of the infection to other animals and humans. So to kind of talk a little bit more on the zoonosis of Ebola, like I said here, the possible reservoir host here is the African fruit bat. And with a reservoir host, it's not experiencing the acute illnesses or the acute illness effects of the virus, which proposes that transmission is through host-host contact, which either be a dead-end host here, where the host dies following the infection, but along the lines of the infection, transmission is occurring during the virus's attack on the body, or we're talking about via intermediate host vectors, such as talking about the African fruit bat. So signs and symptoms of Ebola virus. So they present within 2 to 21 days post-contact with the Ebola virus, with 3 days really showing side effects. Signs and symptoms are very paralleled or in common with a lot of other infections or illnesses. So we're looking at fever, severe headache, fatigue, diarrhea, vomiting, abdominal pain. Those are signs and symptoms of, say, influenza or malaria or typhoid fever. In addition to myasthenia, which is muscle weakness, and random hemorrhaging that can occur along the virus's infection with the host. As far as transmission and diagnosis goes, so we talked about direct host contact, but this is happening via broken skin, whether it be a cut, a laceration, a possible scab, or through mucous membranes such as eyes, nose, mouth, and also other blood or bodily fluid contact. Contaminated needles and syringes from an infected host. There could be recycling of needles or drug users sharing needles. This is a good way for Ebola virus to spread through that blood and bodily fluid contact here. Again, we talk about the zoonosis, so we're looking at infected animal contact here, either through urine or animal feces, or improperly prepared meats or meat from an infected animal. The Ebola virus can actually remain dormant in some bodily fluids from a recovered patient, such as semen in males, for instance, even though they are asymptomatic at the time the virus can be transmitted via that direction. Once infected and signs and symptoms begin to develop, that is when the person is deemed infected with the Ebola virus and contagious. Confirmation diagnosis is made through laboratory tests and via blood sampling. As far as treatment is concerned, there's no vaccination or immunization against the Ebola virus, but the best course of treatment here is supportive care. So we're talking about intravenous fluids here, electrolytes, oxygen therapy to maintain good tissue health, and actually medications to alleviate symptoms such as fever, and actually treatment of secondary infections that can occur following the initial infection of the Ebola virus. Recovery is mainly dependent on a patient's own personal immune system and good supportive care. If a person is able to recover from the Ebola virus infection, they may experience long-term complications such as joint and vision problems. As far as prevention is concerned here, so if traveling or living within a region that is infected or an Ebola virus infected region, we're looking to avoid the following help. Avoiding the following helps prevent the spread. Contact with bodily fluids and blood, saliva, sweat, vaginal secretions, semen, urine, feces here. And then also items that come in contact with a person's blood or bodily fluids. This can mean either clothes, bedding, or needles, like I said. And then actually we're looking at burial rituals involving the handling of a body who expired from the virus. The virus can remain dormant in an expired body for 3 to 7 days post-death or post-mortem. and then again, contact with affected animals and with raw meat prepared from a potentially infected animal of the Ebola virus. Like I said, currently no vaccine licensed under the U.S. FDA approval, but there is an experimental vaccine such as the RVSV-ZEBOV, which, according to the World Health Organization, in their clinical trials, has been proving significantly that it's highly effective against protection against the virus. And with that said, the U.S. FDA is hoping to have stamp of approval of this vaccine within this year or the next. Now, to kind of tie that all into the actual outbreak that is occurring in the Democratic Republic of Congo, or the DRC, like I said, the outbreak, there's been a number of outbreaks from 1976 when the Ebola virus first was founded. The most recent is in August 1st, 2018 of last year. The DRC Ministry of Health reported or confirmed a case of the Ebola virus in North Kivu province, spreading actually eastward towards the South Sudan and Ugandan border. And unfortunately, in June 11th of 2019, the Ugandan Ministry of Health confirmed their first imported Ebola case came from the DRC, with two more cases confirmed following that day. Currently, this current Ebola outbreak in the DRC is their 10th. It's the largest outbreak in the DRC. It's the second largest Ebola outbreak in the entire world since its discovery in 1976. With that said, the CDC is assisting the DRC and the Ugandan government, as well as other regions affected or around the affected region in the DRC. So looking at this picture here, we're looking at the red region being confirmed cases, as well as the yellow region being the surrounding affected zones or provinces. This border here is the Ugandan border, South Sudan, and then obviously the DRC. So the CDC, like I said, they're also assisting the World Health Organization in terms of attacking this outbreak, as far as data management, health education, screening, surveillance, infection control, everything along those lines. So in talking about the Ebola outbreak preparedness, we're looking at, this kind of can go parallels with prevention here. So we're looking at, number one, early detection. So it's, like I said, it's difficult to distinguish from other illnesses based on the common signs and symptoms. But it's important for early detection to quarantine those people if they're showing or potentially showing those signs and symptoms within that 2 to 21 day span. Another outbreak preparedness would be contact tracing. So this methodology is all the contacts associated with a person who is confirmed infected with Ebola virus. Those people are heavily surveilled for showing signs and symptoms of the Ebola virus within 21 days. So within that 21 days, they do show signs and symptoms, then the people associated with that new incident, they need to be quarantined and they need to be surveilled for an additional 21 days until there are no more incidences occur. So it's basically staying one step ahead of the outbreak of the spread of the infection here. An important fact, though, is that the World Health Organization declares that an Ebola outbreak is expired or over after 42 days without incident cases established. So to kind of then bridge what my role is as a state medical officer in relation to the Ebola outbreak in the DRC, my job is basically team leader. I'm a team rallier, the spearhead that is looking at prevention, control, and treatment of outbreaks such as the Ebola outbreak in the DRC. I'm also looking at data and analyzing based on occurrence rates, etc., demographics, geographical isolation points, to be able to provide significance towards an effective intervention in a multidisciplinary approach to make sure that the intervention that I advise with help from my team is efficient and effective against the outbreak and the spread of that outbreak hopefully with all intentions to prevent that outbreak from occurring again. So looking at the Ebola outbreak in the DRC right now, I like to look at this as a call to arms. So basically, to kind of tie in what I was saying about the state medical officer, my role, as the responsibility of a physician leader, my role is extremely varied and multidisciplinary, like I said. In this Ebola outbreak, it would be to manage and coordinate all of the healthcare work, the entire healthcare workforce as team leader, so to speak. I am mainly responsible for patient and provider safety, as well as managing the actual approach to provide such care as far as interventions are concerned, especially during this time of Ebola outbreak prevention. And actually, as a state medical officer, I will take a clinical and administrative approach at investigating this outbreak, as my background is in both disciplines here. So to kind of talk about the initial plan of action from the initial time when I first become discovered about the new occurrences or new incidences to the prevention and intervention part, initially I would be contacted or notified by local hospitals, field hospitals, and clinics that have been seeing an increased number of confirmed Ebola cases via laboratory testing, blood sampling. Then from there, I need to maintain close contact with those hospitals and those clinics to make sure that they have the adequate and fully equipped to deal with this epidemic. It's very important. We need to be able to treat the existing cases. And then if need be, I'll have to acquire additional resources that are needed to properly treat these infected individuals. Now, in addition to treating the existing cases, I need to be able to develop a course of action to prevent further cases here, based on data collection, analysis pertaining to the occurrence rates, and then comparing that data to past collected data. It is then my job to compare these data to be able to find common links or differences between them. And then administratively, I would come and instruct the healthcare teams, such as the district MOs, the state veterinarians workforce, to ask specific detailed questions regarding a patient's history and potential exposure sites, and then to be able to compile and organize that data to relay that to my epidemiologist and my team to look for a detailed analysis on the prevalence, the geographical range of the outbreak, and possible outbreak sources. Here, it's imperative for me to keep in contact with the CDC and other higher-up organizations to report my findings, request further assistance if necessary, and to also aid with devising a plan of action, a plan of intervention, a plan of action for the control and prevention of this outbreak. As prevention is number one here. So with no current approved vaccination currently, prevention is number one. This mainly entails hand washing. It's so simple, but yet so effective. So hand washing goes as far as if your hands aren't visibly dirty, but you're in a contact or in an Ebola infected region, alcohol-based hand sanitizer will work. If your hands are visibly dirty, visibly soiled, then hand washing with soap and water is very important, and proper hand washing technique here. Also, minimizing contact with humans as well as animals affected with the virus. Safe sex practices, like I talked about. Even though a male might be asymptomatic, the Ebola virus can still be transmitted via their semen. Safe meal preparation practices, like I talked about with meat preparedness from a potentially infected animal, as well as health screening and early detection in terms of, like I talked about with contact tracing here. And then definitely an educational promotion and awareness campaign to be able to communicate what I've talked about in this presentation to people that didn't see this presentation. People that are living in rural areas that are within the confines of an Ebola outbreak investigation. They need to be made aware of what they need to do to stop the spread of Ebola virus. So to kind of tie this all together, The Ebola outbreak currently in the DRC, it's a collaborative effort here. It's a work of teamwork and in both prevention and control of the outbreak. So in order to resolve or to hinder this outbreak or the spread of Ebola, it's going to require a diverse team of specialists. So a multidisciplinary approach, like I said, encompassing, for instance, a state veterinarian to relate the zoonotic aspect of the spread of Ebola, the environmental specialists to advocate for external factors that influence the control and prevention of the outbreak, the epidemiologists to analyze the data from variable sources and demographics, the policy analysts then to implement proper protocol on preventive and treatment demands. And then also my role as a state medical officer to spearhead the effort on all fronts and to unify the force to combat the outbreak of Ebola virus. So I really like to believe that this picture of teamwork here with the dogs is a good representation of how simple it can be, or not simple, but a collaborative effort to combat the virus and the spread of the virus. I like to think that this little dog here is washing his hands. So with that said, I appreciate your time for watching this presentation. Hopefully someday that we will be able to completely stop Ebola, whether it be through preventive efforts or vaccination, immunization. I hope that one day we can see an improvement here, a definite improvement against Ebola. So thank you very much.